Mpox has been around for quite some time. We've known about it, but up until recently, the outbreaks have mainly been geographically isolated or located within the continent of Africa. In 2022, we saw a large worldwide outbreak of a clade or strain of monkeypox virus that luckily at that time it's associated with a less severe form of Mpox disease. But we still saw cases worldwide, including here in the United States. Most recently, at the end of last year and continuing through this year, the other clade of monkeypox virus that's more associated with severe disease is causing a very large outbreak in the continent of Africa. And we've seen some sporadic cases of that more severe strain outside of Africa. This is the strain that's causing this more recent outbreak in Africa and sporadically through some other countries. The mortality rate can range between 3 and 10% of those who come down with the disease. So it is a much more severe form of the infection than the one that we saw a worldwide outbreak in 2022. In Africa, they're seeing more cases in young children, which implies that more routine contact may allow for spread of the virus. Whereas in the 2022 outbreak, it seemed like more intimate, close contact was required for the virus to spread. In most cases of Mpox, individuals will come down with lesions, blister-like lesions near the site of infection. In certain patients, especially those with a compromised immune system, that presentation of their lesions can be throughout the body. And in some cases, individuals can have what we call a disseminated disease, where the virus can infect a number of different organ systems, and it can lead to hospitalization and death in some cases. And they're really trying to get in the Mpox vaccine into Africa to increase the number of those vaccinated against it to help drive down the number of infections there. There's also tests available for Mpox. So we do have, to a limited degree, some tests within the US and in other countries to diagnose cases.